Ya Ali Madad. My name is Dr. Murad Tarmohamed. I am a general surgeon at the Kilimanjaro Christian Medical Center Hospital in northern Tanzania, a zonal referral hospital for about 15 million Tanzanians. The COVID-19 pandemic has affected communities in all aspects of their daily life, from physical interactions to mental health and spiritual well-being. To address the challenge, I was privileged to work with the leaders of the Jamaat to support its members in various areas. A lockdown was anticipated. As such, we planned for procuring and distributing groceries and essential medicines for members of the Jamaat to last them at least a few months into the lockdown. There was an acute shortage of face masks at the time. Prices of hand washing and sanitizing agents skyrocketed. However, we managed to stock some and provide for the Jamaat. We made phone calls at least twice a week to check on members of the Jamaat. This comforted them and helped us to monitor the situation. Our phone calls extended to families that were stuck abroad as the flights were grounded, and while we couldn't do much for them, it kept us socially connected at the least. Anxiety and panic attacks were expected in this situation. To make matters worse, we headed for the dry season, and common cold only added to the anxiety and fear of having contracted the virus. We received more phone calls and had to monitor these members very closely on a daily basis, often relying on clinical judgment alone, since testing for the virus isn't readily available. As a doctor, I had to fight my own fear of letting someone slip into the pandemic without being diagnosed. Relying on my clinical skills and basic medical school training is the only choice I had to combat my fear. Counseling, reassuring, and providing consultation did not stop at phone calls. On some occasions, it involved making home visits and facilitating treatment for other conditions at the hospital. For the wider community, together with leaders of the Bohora, Itnashri, Sunni, and Sikh communities, we worked on an isolation center that would cater for suspected or confirmed COVID patients in case the hospitals were overwhelmed. The setup was a lodge that went out of operation due to the pandemic. We focused on the details of the setup so that the center itself does not become a focus of the pandemic. It was like building a mini hospital. We identified doctors and nurses to serve the facility and equipped it with needed amenities. We trained these doctors, nurses, and support staff on wearing and discarding personal protective equipment. Fortunately, we haven't had to use the center to date. On the other side, as the pandemic evolved and reached Moshi in early March, KCMC Hospital started taking necessary steps to contain the spread of the virus. Services were limited to emergent and urgent cases only. We underwent extensive training in the wearing of PPEs and how to approach and attend a COVID patient. We developed protocols for management of surgical conditions in COVID patients, and of course, all patients were treated as suspects until proven otherwise to ensure safety of other patients and healthcare workers. In all this, doctors and nurses have emerged as frontline heroes. However, it is important to acknowledge many others, from allied health professionals to porters and housekeepers, not forgetting the heroes in the general community, those who sell us our groceries, domestic workers, and all the volunteers who work hard to keep their communities safe. All these folks deserve appreciation, and not just doctors and nurses who tend to be the faces of frontline workers. As the virus still looms around us, I urge the Jamaat to continue maintaining physical distance, always wear a mask, and practice regular hand hygiene. keep yourself hydrated at all times. I pray that we overcome this pandemic and that life returns to normal. I wish the Global Jamaat a joyous Eid al-Adha Mubarak. Thank you and Ya Ali Madad.